you take a second? Very good. So I want to welcome everybody. Again, I apologize for the technical issues we're having this afternoon, but technology likes to turn on us at the worst possible moment, and here we are again. I am Gary Harbison. I'm the Executive Director of the Missouri Coalition for Oral Health. MCOH is a nonprofit dedicated to improving Missouri oral health. We are a statewide network of oral health advocates. We raise awareness, engage with community members, advocate for policy change and system improvements, and work together to increase health equity. Please follow us on Facebook, Twitter, and LinkedIn, and through our website. We are very pleased to present this webinar on HPV and oral health. We are interested in this topic because we are interested in improving Missouri oral health and public oral health. Increasing HPV vaccination is an opportunity to save lives through the action of dental practitioners. I want to be sure to thank the Missouri Primary Care Association for providing CEUs. You'll hear a bit more about the CEU process in a moment. I also want to thank St. Jude's Children's Research Hospital's HPV Cancer Prevention Program, Julia Neely in particular, for their sponsorship of this important webinar. And I want to thank the Bureau of Immunizations at the Missouri Department of Health and Senior Services for their sponsorship. As always, we greatly appreciate the collaborative work with the Missouri Office of Dental Health and their support in putting this on. Thank you all for being here. Your participation is already demonstrating that this is an important topic. And I want to be sure to thank Dr. Miller for sharing her expertise. Because of the number of participants, we have set this up as a webinar, which means that everybody that comes in is muted and their video is off. And as you heard earlier, we are recording this, and we'll make the recording available at a later date through our website. At the end of the session, we will provide you with the CE code, and you will also be getting a survey link so that you can get CEs. The link should come to you in an email, but we are also going to post it in chat near the end of the session. I do want to mention that although we have the recording planned to have it available on our website, we cannot give CE for watching the recording. And with that, I am going to turn it over to the hardworking Ashley Herman with MCOH to introduce Dr. Miller.
Thank you, Gary. Again, I'm Ashley Herman. I'm the Community Outreach and Project Development Director with the Coalition, and it's my honor to introduce Dr. Miller today. Dr. Jacqueline Miller is a diplomat of the American Board of Orthodontics and a fellow of the International College of Dentists and the American College of Dentists. She's a member of the Southwest County Dental Society, the Missouri Society of Orthodontists, Midwestern Society of Orthodontists, American Association of Orthodontists, and the Washington University Orthodontic Study Club. Dr. Miller served 11 years in the Midwestern Society of Orthodontists, culminating in serving as the first female president of the Midwestern Society of Orthodontists in 2011. Dr. Miller is a founding member and vice president of the Washington Overseas Medical and Dental Mission. Serving since 1992, excuse me, she has organized dental mission trips to third world countries. She helped establish a daycare and dental clinic in Pimenta, Honduras. Dr. Miller has received the Spirit of Mercy Physician Award from St. John's Mercy Hospital in recognition of her many humanitarian activities. In 2016, the American Association of Orthodontists awarded Dr. Miller the Humanitarian of the Year, and the Midwestern Society of Orthodontists gave Dr. Miller the Earl E. Shepard Distinguished Service Award for her service to the Midwestern Society and her volunteer efforts. In addition to all of that, Dr. Miller also participates yearly in the Give Kids a Smile event and many other local free dental programs. It's my honor to turn the floor over to Dr. Miller.
Thank you so much, Ashley, and thank you, Gary, and thank you everyone for being here this afternoon. Definitely taking time out from your busy Friday to join us for this webinar entitled A New Side to Preventive Oral Health Care, Increasing HPV Vaccination, where we will be discussing a novel approach utilizing all dental professionals, including dentists, dental hygienists, dental assistants, and dental front office personnel to work together to increase Missouri's human papillomavirus vaccination rates. Let me start off with just a little background about myself. I'm Dr. Jackie Miller, a practicing orthodontist in Sullivan, Eureka, and Washington, Missouri. So you might be wondering why a practicing orthodontist is speaking on HPV vaccination. Well, as stated by Ashley, I have quite a bit of volunteer dentistry in my background, both in Missouri and abroad. This volunteer work led to grant writing for various public health improvements in Honduras, including water well drilling equipment, water purification units, an elevated water tank that provided water 8 hours a day for an area of Honduras that was only receiving water 1 hour every other day. All of these experiences of volunteer dentistry, grant writing, and organizing medical and dental brigades in Central and South America have led me to complete a master's public health and to pursue, quote unquote, an encore career in public health. Vaccinations were a focus in my master's program, and I wrote numerous papers about the HPV vaccine, which is the only vaccine, let me repeat that, the only vaccine out there proven to prevent cancer. With this interest in the HPV vaccine, my master's practicum was completed with Dr. Guy Deaton and Julie Beckman of the Missouri Office of Dental Health. My practicum project was the implementation of a dental HPV program, which was adapted from a successful program in New Jersey. Hopefully, you all are aware that this month, April, is National Oral Cancer Month. But do you realize that every hour, 24 hours a day, 365 days a year, someone dies of oral or oropharyngeal cancer? This year, an estimated 54,000 new cases of oral cancer will be diagnosed in the US. Of those individuals, 43% will not survive longer than 5 years. And the many who do survive suffer long-term problems, such as severe facial disfigurement or difficulties with eating and speaking. The death rate associated with oral and oropharyngeal cancers remains particularly high because the cancers are routinely discovered late in their development. This information is from oralcancer.org. What if we, you and I, and all dental providers out there could prevent a majority of these cancers with the vaccine? Think about this for a moment. What if you, as the dental professional, can be part of preventing cancers versus just diagnosing cancers? Our webinar today will start with HPV vaccination background, move to how dentists and other dental providers should be involved in preventing HPV oropharyngeal cancers. We'll describe the new novel approach of the HPV dental program, which was implemented in 8 New Jersey federally qualified health centers, how to implement a similar project in our Missouri dental clinics, and how FQHCs can bring this program together, how to utilize motivational interviewing and talking to parents, patients, and caregivers about HPV vaccination, and finally, addressing barriers to implementing the program and offer solutions to help the implementation of the program here in Missouri. This webinar will be approximately an hour with an additional 20 to 30 minutes at the end for a discussion and question and answer session. I'd like to end promptly at 1:30. For all those who have signed up to this program will receive an hour and a half of continuing dental education. Please do not hesitate to ask questions during the chat feature, using the chat feature, and I can answer questions anytime during the program. The core objectives at the end of this hour will include raising awareness of the importance of the HPV vaccine to prevent oral cancer, teaching the dental team how to educate patients on the importance of the HPV vaccination series, as well as making sure the dental team is supporting and helping to implement the HPV program, and increasing the awareness of the program utilized in New Jersey to boost HPV vaccination rates in FQHCs, and the implementation in Missouri and other dental offices. We'll also be diving into motivational interviewing, as I noted before. So why do we want to increase HPV vaccination in Missouri? That's an excellent question. It's the only, and may I repeat, the only vaccine that we have available that is cancer prevention. Here are things you should know about the human papillomavirus. The virus is very common It's found in many, many people, and it can lead to 6+ types of cancer, including being the leading cause of oropharyngeal cancer. HPV is spread through intimate skin-to-skin contact and is mostly asymptomatic. For the majority of people, HPV will go away on its own and never cause any medical issues. However, there is no way to tell who will develop chronic health problems from an HPV infection and who will not. Most people who become infected with HPV don't even know they have it, which means they can easily pass it along to others. According to the Centers for Disease Control and Prevention, HPV is thought to cause 70% of oropharyngeal cancers here in the United States. At this time, 43 million Americans are carrying the human papilloma virus, and 4 out of 5 will be infected during their lifetime. There are 13 million new infections annually. There are more than 150 different strains of the virus, but in particular, HPV 16 causes 60% of the oral cancers, and 14.7% of Americans are infected with oral HPV. Unfortunately, this high prevalence of the HPV virus will lead to a tremendous amount of various cancers, which include penile, anal, cervical, vaginal, vulva, and of course, oral cancer. Decades ago, and this is when I was in dental school, most oropharyngeal cancers were caused by smoking, heavy drinking, and substance use. But today, HPV has become the largest contributor to oral cancer. As noted earlier, this year, an estimated 54,000 new cases of oral cancer will be diagnosed in the US. In the past, HPV cervical cancers were the #1 type of cancer caused by HPV. More recently, numbers of oropharyngeal cancers have increased tremendously and have become the leading type of cancer caused by HPV. Actors Michael Douglas, Val Kilmer, and Megadeth lead singer Dave Mustaine have all lived with HPV-related oral and throat cancer, which has brought and focused attention to the rising rates of mouth and throat cancers from HPV. The HPV vaccine first came on the market in 2006. As of 2020, more than 270 million doses of the HPV vaccine have been given worldwide, including 120 million doses here in the United States. Scientists and health organizations around the world continue to closely monitor HPV vaccination safety, and there have been no serious side effects recorded. Prevalence of HPV infections have drastically declined among teenage girls and young women since the introduction of the vaccine back in 2006. A recent study has noted that with more girls receiving the HPV vaccine, cervical cancer has dropped 88% in young adult women. That's an incredible amount. The HPV vaccine is effective prevention for 6 types of cancers, including oropharyngeal cancer. So more than 34,000 cancers can be prevented each year. Over 90% of HPV cancers are preventable through HPV vaccination. According to the CDC, 3 HPV vaccines have been licensed in the United States: Gardasil, Gardasil 9, and Cervarix. Gardasil 9 has, since 2016, been the only HPV vaccine used in the United States. It prevents infections from the following 9 HPV types: HPV type 6 and 11, which causes 90% of genital warts; HPV types 16 and 18, 2 high-risk HPVs that cause about 70% of cervical cancers, and an even higher percentage of some of the other HPV-caused cancers. And then it also includes HPV types 31, 33, 45, 52, and 58, which are all high-risk HPVs that account for an additional 10 to 20% of cervical cancers. In other words, Gardasil 9 covers the majority of the HPV strains that cause cancers. The CDC currently recommends giving the HPV vaccine routinely to children ages 11 to 12 and as early as age 9 through the age of 26. If the vaccine is given on time between 9 and 14 years, 2 doses are recommended, with each dose 6 months to 12 months apart. ideally 6 months. On or after the age of 15 years, a 3-dose regimen is recommended, with the second dose 1 to 2 months after the first dose, and then the third dose 6 months after the first dose. It's actually best to receive the vaccination between the ages of 9 and 12 because the immune system of a young adolescent, boy and girl, responds better than an older adolescent, and thus better coverage is achieved. According to the National Foundation of Infectious Diseases, younger adolescents, those younger than 15 years, have a 2 to 3-fold higher HPV antibody levels after HPV immunization compared to older adolescents age 16 up to 26. So it's best to get this vaccine at a younger age and make sure to either get all 2 doses or 3 doses depending on the age. HPV vaccination rates vary by state, as you would expect, from a low of 31% of adolescents being HPV up to date in Mississippi to a high of 79% in Rhode Island. Some states require HPV vaccination for school entry. These states include Hawaii, Rhode Island, Virginia, and Washington, D.C. Why are we pushing for a higher rate of HPV vaccination here in Missouri? Unfortunately, our Missouri vaccination rate is only 53.6%, which is well below the national average of 58.6%. And Missouri ranks 27th in the nation for HPV vaccination coverage. Any way that we can increase the vaccination rate to decrease multiple cancers in Missouri is a win-win for public health. Where do dental providers come into the HPV vaccination process? And why are they asked to recommend the HPV vaccine? Let's think about primary prevention of oral diseases. That's a part of our everyday practice. We educate our patients on diet and oral hygiene in order to prevent cavities. We routinely screen for oral cancer. So why are we not, as dental providers, recommending the HPV vaccine to prevent oral cancer? Both the American Academy of Pediatric Dentistry and the American Dental Association recommend educating patients, parents, and caregivers about the relationship between HPV and oral cancer and urge all dental personnel, dentists, hygienists, dental assistants, to support the use of the HPV vaccine. You may be thinking this is great that the AAPD and the ADA support HPV vaccination, but will my parents, patients, and caregivers be receptive to my initiation of the conversation about the HPV vaccine at my dental office and at my dental chair? Well, here's the good news. A 2020 study in the Journal of the American Dental Association shows that 73% of parents feel that you, the dental provider, are trusted and qualified to discuss HPV. This is great news. However, studies have shown that oral health professionals are not always confident talking to their patients about HPV. Lack of access to proper information about HPV-related oropharyngeal cancers, insurance reimbursement, and parental concerns were some barriers listed in this study. So the great news is people trust us to talk about HPV, but how do we go about educating ourselves and incorporating this discussion into our daily work schedule? Let's take a look at how New Jersey coordinated their program. While doing research for one of my many papers as part of my public health master's, I came across a research article published in the Oral Health and Dental Science Journal. It was entitled, "Dental Interventions Improve Youth HPV Vaccination Rates to Help Prevent Oral Cancer." This particular article was written by Dr. Sam Wakim, a dentist working at a federally qualified health center, and Dr. Rena Ramirez, a physician working at the same FQHC in New Jersey. These doctors worked with 8 federally qualified health centers and coordinated a program entitled Project AIM, which integrated dental and medical teams for a collaborative program to prevent oral cancers by increasing HPV vaccination rates. Their HPV vaccination rate increased from 12% to 31.8% within 1 year. This is a 259% increase in the FQHCs that were working on the program. 259% increase. That's incredible and completely unheard of. This published paper was available at the end of this presentation. There's a Google Drive. There's a QR code to a Google Drive, as well as the code on the internet. You'll have access to that at the end of this presentation that will include all kinds of information, as well as the research studies that were recorded in this presentation. If you're interested in establishing a vaccination program in your office or FQHC, I would highly recommend that you read this article. It's a great resource. My practicum, as I mentioned, was with the Missouri Department of Oral Health and was aiming to emulate the New Jersey program, working with 3 clinics here in Missouri. I was working with Dr. Ben Connor at the McCully Clinic in Washington, Missouri, Dr. Chris Cook at the Comtree Health Center, and Dr. Mac Taylor at the Southeastern Missouri Health Network. The dental professionals were taught to utilize motivational interviewing and culturally competent education about the strong tie of HPV infection to head and neck cancer and the importance of the HPV vaccination series to prevent multiple cancers. If the parent, patient, or caregiver agreed to the vaccination series, they could be escorted to the medical side of the FQHC to begin the vaccination series, and the medical offices would follow up with the second, and if needed, the third dose. The program also included laminated brochures, patient education materials, and training on implementation of the program, along with training on motivational interviewing. The dental directors of each of these centers have started to utilize the HPV vaccination program in January. Unfortunately, at this time, I don't have any statistical results from the FQHCs, but Dr. Ben Connor at the Mercy McCully Clinic reported that as of February 22nd, 22, he had given HPV vaccination to 51 patients. 6 patients started the HPV vaccine series, but 33 had already started the series. Of his patients, he was able to access their Mercy records and estimated that 64.7% of his patients were vaccinated prior to 2022. So this was actually up to 76.5% in 2022. He feels the education he is providing is making a positive difference in the HPV vaccination rate at McCully Clinic here in Washington, Missouri. The main objective of the HPV vaccination program is to utilize dental care providers as an additional avenue and resources to spread awareness of the importance of the HPV vaccination series and the ability to prevent oral cancer. Many adolescents are visiting their dental care providers, hopefully twice a year. This additional avenue for education and engagement about the HPV vaccine is crucial. In addition, many of the Missouri's FQHCs have a medical and dental component. Starting the HPV series may be possible the same day as their dental checkup. We are trying to create an urgency to vaccinate children now for better immunization coverage than if they receive the vaccination series later. We're also trying to make sure patients complete the series with either the 2 or 3 injections. When starting to set up the program, either at your FQHC or your dental office, we started with a conference call with the dental director, the medical director, and a locally appointed vaccination champion. Many times this is a dental hygienist, to map out a plan of action that is unique to their particular clinic and customized for the culture of their area. Ideas are generated as to how to implement the program, and a list of jobs are assigned to each member on the call. A PowerPoint presentation was utilized to educate the members on the concept and the implementation of the program, along with another PowerPoint presentation of motivational interviewing. These PowerPoints will be again available at the end of this presentation in the shared Google Drive folder. The critical point is that the entire office must understand the importance of the HPV vaccine and be all in educating their patients about the link between oral cancer and HPV. Flagging the patients between 9 and 18 years old, have a vaccination champion, either the doctor or the hygienist or the assistant communicating with the patient's parents and caregivers. And if there is a medical clinic associated, collaboration with the medical team to track the vaccinations and follow up for completion of the vaccination series. Before implementation of the program, the designated vaccination champion was tasked with gathering initial statistics of HPV vaccination rates for their dental clinic and/or medical clinic. We started with asking IT to develop a program to identify upcoming patients aged 9 to 18. These names were then compared with the Missouri program Show Me Vax or their medical records, such as the Mercy record, to check on their vaccination status. So basically, any kids that were coming in between the ages of 9 and 18, they checked to see if they had started the HPV vaccination process or not. Those who have not started or completed the HPV vaccine were basically flagged on the computer system for motivational interviewing about the HPV vaccine by the vaccination champion, the doctor, the dentist, or the hygienist, or the assistant. We also added a drop-down option on all records of patients 9 to 18 asking about their vaccination status as a reminder to ask each time from our dental team. Those who have not started or completed the HPV vaccine were flagged, of course, for motivational interviewing. Let's talk a little bit about this. Motivational interviewing is a patient-centered method which provides a collaborative approach to behavior change in a safe, non-judgmental, and supportive environment. Patients, parents, and caregivers can take control of their behaviors and are therefore more likely to succeed in any subsequent behavior change. Motivational interviewing is a useful method to promote behavior change, and it can be successfully used in dental practice settings. In our case, a way to encourage the acceptance of the HPV vaccine. Motivational interviewing, I'll shorten it to MI, can be used by all dental professionals with their patients for positive changes such as smoking cessation, increasing adherence to better oral hygiene, and encouraging our patients, 9 to 18-year-olds, to undertake the HPV vaccination series. This approach helps patients accept responsibility for their health and encourages autonomy in their decision-making. The goal is to evoke a positive behavioral change from within to improve health. A patient-centered approach is more likely to result in a patient taking positive actions towards behavior change. This may mean that the clinician, rather than telling the patient what to do, simply guides them in their decision and supports them towards an achievable goal. Dental care providers are constantly educating their patients on oral hygiene and other things that will improve their oral health. Utilizing MI is a proven way for positive behavioral change, such as undertaking the HPV vaccination. Again, I have shared this Google Drive, the motivational interviewing, and well as the program for implementing this are all in that Google Drive. You can even download the PowerPoints that I developed.
Can I interrupt just a second?
Absolutely.
So you have a question from Susan Baer. Did the patients and responsible parties understand that their medical records were being accessed for this purpose?
Excellent question. I am not sure of the answer to that. I would have to ask the dental directors and then Dr. Connor. As the dental directors and Dr. Connor, especially with the McCulley Clinic, part of he would access the medical as part of his dental care to make sure that there's no medical reasons or pre-medication or anything that would need to be done. So most everybody has access to those types of programs, and as well as the Show Me Vax. So I can't give you, I can tell you for sure Dr. Connor had access because of the Medical Mercy records, but I'm not sure about the Show Me Vax. But that's a great question, and I will look into an answer to that.
And while we've taken a break, you have another question. Can't adults take the vaccine as well? Are patients over 18 being encouraged to look into the vaccination series as well?
I'm so glad that it was asked. Actually, they've expanded up to age 26, and they've even expanded it into the 40s and the 50s. So yes, adults are definitely encouraged to undertake the HPV vaccination. It's just not 9 to 18. We had to kind of focus the numbers. And as you'll see later too, when it comes to being able to access free vaccinations, that is up until the age of 18. So that's another way that they can receive free vaccines. So that's kind of where we focus the 9 to 18. But yes, adults can receive the HPV vaccination, I think up until 40s and 50s. Thank you for that question. Okay. Many times the dental practitioner may encounter vaccine hesitancy. Well, that's something new, especially in this day and age. According to a 2022 study, there are different levels of parents' level of vaccination hesitancy for the HPV vaccine. These include very hesitant, somewhat hesitant, and unsure. The reasons for lack of intent to vaccinate and very, very hesitant parents were in rank order. Number one was safety concerns and side effects. Number two, lack of necessity. Number three, reporting that the adolescent is already up to date. In other words, not necessarily knowing about the vaccine. 4, reporting the adolescent is not sexually active, therefore does not need the vaccine. And 5, lack of provider recommendation. On the other hand, the most common reasons reported by somewhat hesitant parents were safety concerns and side effects and lack of provider recommendation. When you come down to parents that were unsure, their biggest concerns were lack of provider recommendation and lack of knowledge. The results presented suggest that tailoring interventions to the parent's level of hesitancy could provide a greater impact compared to a one-size-fits-all approach. Most hesitant parents are primarily concerned with safety, a persistent concern which continues to plague the HPV vaccine, even though it's been around since 2006. You may want to have an informational brochure showing the 9-valent HPV vaccine, the Gardasil 9, the quadrivalent HPV vaccine, Gardasil, and the bivalent HPV vaccine, Cervax. They all went through strict safety testing before the U.S. Food and Drug Administration licensed them. More than 135 million doses of HPV vaccines have been distributed since they were first licensed. Over these 15 years of monitoring and research during the vaccination program have continued to show the HPV vaccine is both safe and effective. So what's your message about HPV? As the dental professional, you need to give a strong HPV vaccine recommendation for both boys and girls between the ages of 9 and 18. And as we noted, that can go on for older adolescents as well as young adults and adults. Why are you recommending the vaccine for 9-year-olds? You need to be able to answer those questions. Why do you recommend the vaccine for both boys and girls? Where can someone obtain the vaccine? These are all messages that you need to put out to your parents, patients, and caregivers, as well as have the answers to all of these questions. These are all questions you need to answer confidently. You can also download or make educational materials that are culturally relevant to your area and your patient population. Again, laminate these patient and parent informational brochures and place them in high visibility places, both in the operatory and reception areas. Make sure your clinic team is all on the same page with similar questions to patient-parent questions and messaging about the HPV vaccine. If you're part of a medical dental FQHC, let them know that if they're interested, they can start the vaccine at the medical clinic today. The shared Google file at the end of this presentation has, again, resources you can utilize to confidently answer questions about HPV and the connection to oral cancer. If you do have a medical team within your complex, ask them to collaborate with your HPV vaccination education and administration. Ask the medical team to gather statistics and baseline numbers on the vaccination rates for your particular clinic. Work on workflows to allow same-day vaccinations and set up follow-up appointments for second and third doses of the vaccine. Collect data after the implementation of the project. Are the vaccination rates increasing? Meet once a month with your medical colleagues or your dental team and develop ways to improve the program. Look at your messaging. Is there a better way of presenting? Or look at your workflow and other ideas that might improve the program. This is an excellent example of integrated healthcare for the benefits of your patient population. Let's dive a little deeper into how motivational interviewing can be utilized in encouraging HPV vaccination. There are 4 integrated components that foster communication and incorporate the spirit of MI. These include partnership, acceptance, compassion, and evocation. Partnership includes communication with a person as a partner to collaborate in order to reach a goal such as vaccination. MI is done for and with, not to or on. During this partnership, the patient and clinician develop rapport, and when appropriate, the practitioner asks permission to discuss potential behavior changes. Asking permission lets the clinician know the individual is willing to enter into this discussion. Complementary to partnership is acceptance of the patient's autonomy. Acceptance is understanding the patient's perspective and not being judgmental, ensuring that we focus on their positive health behaviors and support them with their self-efficacy to change. You need to develop skillful reflective listening in addition to this motivational interviewing. Compassion involves a deliberate commitment to actively promote the patient, parent, or caregiver's welfare to give priority to their needs. The evocation component is to attempt to explore what is important to the patient and how they would like to make a change. Evoke and strengthen what's already present, not instill what is missing. So we've talked about developing the skill of reflective listening when working on acceptance of the patient's perspective. So what exactly is reflective listening? Reflective listening invites more dialogue. You reflect content and feeling. You reflect back what you think the meaning may be, and you clarify assumptions using phrases such as, "so you mean," to make sure you are understanding the patient, parent, or caregiver's point of view. Reflective listening involves repeating or rephrasing the person's comments in a way that demonstrates understanding and validation. For example, what I hear you saying is that you think your child is too young for sex, and therefore it's too early to get them vaccinated for HPV. This technique builds empathy and allows the provider to confirm they understand the reasons behind the parent caregiver's hesitancy before moving forward with the conversation. This may also help engaging the level of your person's vaccination hesitancy to modify your dialogue to address their primary concerns. Let's talk about how to utilize motivational interviewing in encouraging HPV vaccination to prevent oral cancer. Let's look at step 1. You want to engage the parent, patient, or caregiver. You need to work to establish mutual trust and respect via acceptance and compassion. You want to work to engage the parent, patient in the general conversation. Every day we do this when we're talking to our patients when they come in for their biannual exams. You have already established and engaged with that patient. Next, you want to present HPV as a topic of conversation, a shared agenda that you can collaborate on. An example might be, I noticed your child has not undertaken the HPV vaccination series. Can we talk about HPV vaccination? The next step is to evoke or draw out motivation via change talk, which we'll talk about in just a little bit, if the parent, patient, caregiver would like to talk about HPV vaccination. Move on to a planning stage to become vaccinated, or what steps might be necessary to become vaccinated. So what do we mean about this change talk? Remember that MI is a therapy style that utilizes empathetic, non-confrontational approaches to help people make their own realizations about their need to change. Change talk is the mentioning of a person's desire, ability, reason, and need to change their behavior. The belief is that a person is more likely to change and stick with it if they personally invest in their own plan to make a positive change, such as better oral hygiene, such as better dietary habits, such as HPV vaccination. When engaging in motivational interviewing, you must pay attention to the language. Is there change talk or is there discord? Change talk may include desire, statements such as, I want to, I wish. Listen for ability talk, such as, I can, or I will. Reasons for change, such as, for my child's health, or need statements, which include, I really need to make this change. When these phrases are used, one can move on to the planning stage. But if discord is detected, this must be resolved before continuing. So what is discord and how do you identify it? There are multiple ways that discord can happen. You need to listen for the following. If there's arguing, challenging, or hostility in the conversation, look for ignoring, which is inattention to the conversation. Is the person looking at their phone? Are they looking at their watch? Are they not engaging in the conversation? Is there a non-answer? In other words, no response, or maybe sidetracking to avoid the conversation. Discord can occur with interrupting. Is the person talking over you? Are they cutting you off? If the parent, patient, or caregiver is negating by denying or blaming others for their lack of vaccination or lack of change, you need to get back on track and reestablish the connection. It's about the parent, patient, caregiver, and their desire to change, not you wanting them to change. And finally, my favorite is pseudo-complying, where they are agreeing to make you happy, but no positive change occurs. I can remember many conversations with my teenage children with pseudo-complying, rolling their eyes and saying, sure, mom, whatever. By developing the ability to recognize discord, you can redirect the discussion and reestablish a positive relationship before you move on to guiding the person to positive change. Once you have permission to talk about HPV vaccination, you may want to use the additional technique of elicit, provide, elicit. Start with elicit. Ask the parent, patient, or caregiver what they already know about the HPV vaccine or HPV itself, and ask if they would like to know more about it. You want to understand what the parent already knows. At this point, make sure to ask if they're open to the dental care provider providing more information. Make sure to ask permission. Then you move on to provide. If they give you permission, present the information in a neutral and broad-minded way. Don't use I or you. Match the information to fill in the gaps in their knowledge. Do not argue with their beliefs. Reflect their reasons for possible vaccination. Finally, elicit or gather the patient's understanding of the feedback provided. This communication technique demonstrates respect for the person and is less likely to create interpersonal discord, as the parent or patient or caregiver now has equal standing in this discussion or conversation. Let's review the motivational interviewing HPV discussion flow. Start with the partnership language. That is basically getting to know the person, establishing a relationship with the parent or the caregiver or the patient. Ask for permission to discuss HPV vaccination. Affirm your personal strong recommendation as a dental provider for the patient to receive the vaccination to prevent oral cancer. Reflect on the conversation to make sure you are understanding the parent, patient, or caregiver. You want to understand their concerns. What might be causing their hesitancy in receiving the HPV vaccine? This needs to be done in a non-judgmental manner. Next, elicit, provide, elicit, as discussed in the previous slide. Utilize empathy, that you understand their concerns, and empower the patient, parent, or caregiver that you are able to make your own decisions about change. Make sure to emphasize their autonomy. Make sure they understand they have control and choice over their own lives. Evoke reasons and needs. So listen and resolve any discord before working to guide them towards the final goal of change. And in this case, vaccination, if they feel that it is in the best interest of their child or themselves. Here is an example of the utilization of motivational interviewing for HPV vaccination. This is a 5-minute snippet from a great webinar by Colleen Marshall on YouTube. And again, you can find a link to it in Google Drive that all the attendees can access with their QR code at the end of this presentation. This example of MI is taking place at a primary care physician's office about the HPV vaccination series. The parent did tell the daughter that there would be no shots at this particular appointment, so the vaccine could not be provided today. But the physician is using MI, motivational interviewing, to help the parent resolve any questions or hesitancy for the HPV vaccine series. Let's see how MI can help in this discussion.
So Tina, would it be okay if we talk about HPV vaccinations for a few minutes?
Oh, sure. I did tell my daughter that there was no shots today for this physical, but happy to.
Yeah, so it's real important for you to honor that, make sure that she doesn't get shots today.
Yeah, I like the doctor to be a place that she can feel, you know, especially going into her teen years. I want her to feel like comfortable coming in, comfortable bringing things up with you. And so trying to make sure that I kind of honor my my promise to her that she wasn't going to have any shots today is important.
Yeah, so it's bigger than just whether she gets an HPV vaccination or not. You're really trying to set up the doctor-patient relationship in a way that it's healthy for her long term. And so you're trying to keep that all in mind today.
Yeah, I know that, you know, particularly as she goes into these teenage years, there may be stuff that she doesn't feel comfortable talking to me about. I would feel comfortable talking to her, but she may not feel comfortable talking to me. So I want to make sure she has a safe place to come and a place to get accurate information, because, you know, there's so much bad information out there that is on the internet. So I want her to feel safe coming here.
Yeah, really want that trusted relationship, so she has a trusted adult and a trusted doctor that she can ask. Yeah, so tell me what you already know about HPV vaccinations, if anything.
Yeah, well, so, you know, I have my daughter and my son. My son is younger, but I think, so I guess it probably just applies to my daughter, and that it's to prevent cancer. And so, yeah, I definitely, you know, I want to do everything I can for her to prevent cancer. It seems like a little young to be talking about it. She's not interested, you know, in boys at all. She just likes her school and sports and music. And so she seems kind of young, but something that she would get later on.
Yeah. So wow, you've done a lot of research already. So you sort of know it's to prevent cancer. You know it's usually for, my guess is you're saying young because you're saying that she's not sexually active. So you know it's before being sexually active, and that it's recommended for girls.
Mm-hmm. Mm-hmm.
Yeah. Would it be okay if I share just a little bit more information about sort of what the recent recommendations are and why we're talking about it right now?
Sure. Okay.
Yeah. Okay. So actually what the CDC recommends is that boys and girls get it, and they get it before they're sexually active. So they target that age of 11 to 12 because typically that's where, you know, it's more likely that child's not sexually active yet. So it's one of the reasons we're talking about it now is because she's in that age range. So what do you think about that? What, if anything, has that done to influence your thoughts about HPV?
Well, I mean, I don't want her to get cancer, and I want to do everything I can to protect her from cancer. That's my job. I mean, that's my job as a mom, even if it means, you know, shot. It's my job to protect her. So, yeah, it feels like that's something important. I don't think, I mean, I guess anything can change, but I don't think we're at risk of like her becoming sexually active next week. But it sounds like something that probably needs to happen pretty soon.
Yeah, so it sounds like it's really important to you. I mean, in fact, you see it sort of as a major responsibility of yours to make sure that you're protecting her. And so getting the HPV vaccination is important to you. Yes. The part that you're wondering about right now is the timing of it, because it's also important she doesn't get it today. Right. And you also think that you have a window of being able to get it to her before she's sexually active. So I'm wondering what you're thinking about timing.
I mean, I can, you know, it's going to be a whole conversation with her. She knows, she's so curious, right? She knows, like, if I have to get the chickenpox shot again, or like, what's this for? What's that for? So it's going to be a whole conversation with her. So maybe, you know, it's an opportunity to talk about sex as well. So maybe I can just, I don't know, can I bring her back for it and just sort of make it a day with her? We can have lunch or go for tea or something, and I can bring her just for that?
Yeah, absolutely. Absolutely. I mean, it sounds like you're thinking in a little while, not today, but you want to think and plan for this conversation. So it's not just about getting the vaccination, but you're also sort of taking the opportunity to introduce the topic of sex and, safe sex practices and things like that. And we absolutely could do a whole, meeting about that where we, both give her the shot, but also talk about any of the safe sex practices you'd like us to cover with her.
Yeah. And I guess I'm just not ready for that today.
Yeah. Seems like it came out of the blue.
It did. But I, it's my job to make sure that, I don't want anything to happen to her that could be preventable. So if we can make a separate appointment for that, it can happen soon. It doesn't have to wait until next year, like you said, but just so I can prepare myself a little bit more.
Yeah, absolutely. Great. So we'll leave it there, and you can make the appointment when it feels right for you guys, and maybe in the next few months or so, and then we can take it from there.
Okay.
Okay, so that,
So Tina, would it be okay if we talk about HPV vaccinations for a few minutes?
hold on, let me move to the next one. There we go. Okay, so that I think was just a great back and forth. It doesn't have to be that long or that in depth, but at least that give and take in the conversation, asking if it's okay to talk about it, giving them accurate information. And in this case, they didn't want to do it that day. They wanted to wait until the next appointment, which is all fine. At least we can get the parent, patient, caregiver thinking about the vaccination, and maybe they might gather information and go from there. Gary, are there any questions I should address before I go on?
Yes, Tony Marcord has a good question. Since very few Black women and young girls are recommended the HPV vaccine by healthcare providers, is there literature tailored towards this group?
I can't say that I've seen specific literature tailored toward that group, but it has to be out there, because you're right, that is an area where we have very low vaccination rates. And there is no reason that individuals can't tailor any information and make their own. It's so easy to make brochures these days with all the different programs out there. Make it your own, make it culturally diverse to your particular area. The information's out there. Like I said, with that Google Drive, there's tons of brochures, but there's also websites that you can go to and download that. That's an excellent question. Thank you. Any other questions before I go on?
Not that I see.
Awesome. Okay. So now that we have a pretty good handle on motivational interviewing, let's move on to addressing barriers and challenges in implementing this program in our own dental clinics and in FQHCs here in Missouri. When speaking to the directors of the 3 clinics after delivering the PowerPoint presentation and encouraging HPV vaccinations in dental clinics and another program on motivational interviewing, all the dental providers seem to be on board, including the hygienists and the assistants. We're all very pro-education in these clinics. Some of the barriers and challenges came up with the extra step of looking at patients on Show-Me-Vax or other electronic medical records to see if their patients were being seen in the clinic on a daily basis actually had their vaccinations. The extra time needed to check each patient between 9 and 18 for vaccination status was a barrier. Other challenges included vaccination pushback. So in some more conservative areas of Missouri, unfortunately, all vaccinations had become politically charged at this time, and even vaccinations which have been normally accepted in the past are all being brought into question. Another barrier was the approval of the HPV program through the quote-unquote chain of command in FQHCs, and difficulty coordinating and communicating with the medical providers to implement the program and work towards same-day vaccinations. A lot of times they may not be meeting with the directors of the medical programs only 2 or 3 times a year, and sometimes it's hard to get everybody together in these FQHCs to be able to be on the same page about the HPV vaccination. Other issues were encountered with staffing changes. In other words, staff turnover, which we have all experienced, especially after the pandemic, where we have new members on the staff who may not be as informed about HPV vaccine as members were previously. When team members are new, they need to have the training for a positive culture and encouraging the HPV vaccine. So there are multiple barriers and challenges with any change in a dental office, but with time, persistence, monthly planning meetings, and addressing the challenges and making modifications, many of these barriers and challenges can be overcome with the positive outcome of decreased cancers in the future. If you take the time to read the paper about the New Jersey experience, they met monthly, and it took 2 or 3 months before they were able to have the correct messaging that was culturally appropriate for their area to be able to encourage the vaccination. So it's going to take time and effort and cooperation, as well as modifications of things to get this program to work in your particular clinic. In case you're not aware, this is what I was trying to talk about earlier. The state of Missouri does offer the Vaccines for Children program. It's called the VFC program. This is an excellent resource to refer patients to before their 19th birthday that are Medicaid eligible if they don't have insurance, if they're American Indian or Alaskan Native, or are uninsured. For more information on the VFC program, and to locate your nearest VFC provider, there is an interactive map on health.mo.gov website. So you can utilize this website, and you can put this into your informational brochures for those who maybe qualify for free vaccinations. They may also have them at your local health clinics as well. So, what are some recommendations on how to bring up the subject of HPV vaccination? We need to capitalize on our biannual patient visits. Many times, a patient may not be receptive to the idea of an HPV vaccine at one appointment, like was demonstrated in that snippet that we listened to, but they may be more receptive after addressing their hesitancy or having time to do their own research about the vaccination. Adolescent patients tend to see the dentist twice yearly, which may be more often than they actually see their primary care provider. This is a window of opportunity for dental professionals to provide counseling to patients about HPV vaccination and HPV's link to oral cancer. Try to include HPV cancer prevention information on your website and social media pages. Suggest parents visit the HPV Cancer-Free Family Facebook group, where members of the National HPV Vaccination Roundtable can answer parents' questions, or follow the Roundtable's Twitter page. On a personal note, I have a female friend who was 30 when she felt a lump in her neck, and she was told not to worry about it. Thankfully, she pushed the issue, and it turned out to be an HPV throat cancer that she did have removed and then went through radiation. Unfortunately, she had not gotten the HPV vaccination as an adolescent, which could have prevented this cancer. With her personal story, she is a huge advocate of HPV vaccination. Anyone she talks to, she mentions the vaccination and how important it is. So what are the next steps in implementing the dental HPV program? Again, start with education and training with your entire dental team, both about HPV's relationship to oropharyngeal cancer and how to do motivational interviewing. Next, talk with patients, parents, and caregivers and address questions and vaccination hesitancy. Set up follow-up reminders on your computer to ask about vaccination progress at their next hygiene visit. Track your progress and vaccination rates. Continuous correspondence and collaboration with the dental and/or medical teams to plan improvements to the program and measure success as well as failures, as well as outcome assessments. Take a look at the PDF entitled Cancer Prevention Through HPV Vaccination, an action guide for dental healthcare providers. It offers plenty of tips to make the HPV program more successful. Knowing that you, as the dental provider, every single person on the dental team can play a life-saving role in preventing cancer for your patients. Download, print out, customize, do anything you can, laminate these education brochures with frequently asked questions, information about the safety of the vaccine and the cancers it can protect the patient from. Educate your patients and parents and caregivers about how HPV vaccination is indeed cancer prevention. If possible, refer your patients to the medical clinic within your FQHCs or their primary care physician. Tell your patients about the Missouri Vaccine for Children's program for free vaccinations if they qualify. Work with your entire office on getting the word out about HPV vaccination and collaborate with your local medical clinics and your local clinics that provide these vaccinations. Make sure you have a unified team and questions can be answered appropriately. Here's your recap. Again, you are the key to cancer prevention. Recommend HPV vaccine to all adolescents. Again, we're focusing on 9 to 18 years, but even beyond, can be into your 20s, 30s, 40s. You can be the dental professional that prevents cancers versus being the one who has to give the news of an oral cancer diagnosis. Remember, knowledge is power. Be prepared to answer questions from patients, parents, caregivers. Collaborate with medical and/or dental teams, especially within the FQHCs, with both clinics to talk about workflows to implement this worthwhile program. It may take a while, but with persistence, follow through, and probably jumping through quite a few hoops, together with our medical colleagues, we can increase HPV vaccinations across Missouri. Again, thank you for this opportunity to share this program with our dental colleagues, hygienists, assistants, everybody who's out there and their clinics. I'd like to personally thank the 3 sponsors of this presentation, the Missouri Coalition for Oral Health, the Bureau of Immunizations, the Department of Health and Senior Services, and St. Jude's Children's Research Hospital. By the way, it's listed again in Google. Take a look at the stjude.org website. This has an HPV cancer prevention program, which aims to reduce HPV-associated cancer deaths locally and nationally by increasing HPV rates. They have a wealth of patient information downloads to educate patients and parents as to the importance of the HPV vaccine. Again, thank you. Before we take time for questions, please take a moment. Here's the QR code I was speaking of earlier, as well as the website. To connect you with the shared Google Drive I've set up with scientific literature, PDFs, and HPV patient education brochures, and a Word document with websites with downloadable parent and patient education tools. In addition, an excellent tool guide from the ADA entitled Cancer Prevention from Dental Health Providers can be found there from the HPV Roundtable. Do not hesitate to contact me by email. My address is listed, or you can call me on my cell phone. I'd like to take credit for setting up that Google Drive, but I have to give my daughter credit for all of that. She is much more computer savvy than I am. So let's open it up for questions and discussion. If there aren't any questions, we'll move into discussion. Are there any questions, Gary?
Let's see, I think there is one. Let's say you work for an anti-vaccine doc. Well, that's a problem right there. What's the best approach for an RDH if unable to launch a program? Education during appointment and info on resources, but potentially no office support?
Wow, great question. And that is a difficult situation to be in. Obviously, I mean, the biggest thing you can do is educate. And you can talk to your dentist that you're with about the importance of the HPV. It's linked to oral cancer. And you can ask, is it okay that I talk about this link with my patients? Would you mind if I did that? I know it may not be something that you personally believe in, but if the ADA is saying to get the word out there, do you mind if I continue to get the word out there about the correlation between HPV and oral cancer? Difficult situation to be in, but ask permission and then provide very accurate information.
Yeah, really good question. And sorry you're dealing with that, if that's not a hypothetical.
I hope it's hypothetical.
Other questions or comments? You are getting some thank yous in the chat, and you got great idea, Dr. Miller. Julia Neely, one of our sponsors, from one of our sponsors, said thank you for the wonderful presentation, Dr. Miller. I have shared the survey link. I will just mention in the chat, and you should be getting an email on that as well, and I'll share it again.
Is there also the opportunity just to share the QR code and the information? There's a lot of information in there. It ranges from parent information to provider information to scientific studies that might all be helpful to everyone if you don't have a chance to take a picture of it with your phone.
Yeah, actually, I did put the link in the chat as well, so you can get to all of that wonderful set of resources that way as well. If you're wanting to use it that way, I'd go ahead and link on that now, even if you're not going to look at it until later, because it'll get you connected to the link. And there's a lot of material out there.
It's amazing. And again, I can't say, I know I tried to be culturally appropriate to some of the areas I was working with during my practicum, but I know there's information that can be culturally appropriate for your clinic. And if nothing else, make it on your own. Engage a younger person who can work real well with all these slides and all that may be helpful, but I'm more than happy to give you any suggestions if you want to email me or text me or anything like that. I'm going to move on to one more, a special thank you, of course, to the sponsors, but then I'm going to bring it back to questions. If we can go through the chat, are there any challenges? I know one person said the challenge would be for a dentist that's an anti-vax. What challenges do you expect in implementing this program in your office? Can anybody think about their office atmosphere? Is there things that you might run into that you don't think you'd be able to implement this in your clinic? Can anybody send some chats my way on that?
Well, people are thinking about that. I do think there can be issues with HPV because there was a big campaign several years ago about HPV. It was very public, and it got all wrapped up in this argument that someone, the government or someone, was trying to encourage promiscuity on the part of young people. And we don't hear so much about that now. And I'm sure there's some of the immunization staff on here could talk to this more directly, but I think that's still flitting out there. Like if you just bring this topic up, it's somehow encouraging sexual activity. And I think that can be a barrier depending upon the kind of the office culture you work in.
I can't quote the study, but I can tell you there have been studies that have shown that that is not the case. There have been scientific studies that have shown that just getting the vaccine and talking about that vaccine has not encouraged promiscuity. So I know the studies are out there, but of course, how did you put that, Gary, about things that are on the internet?
Oh, yeah. The internet's a wonderful place where anybody can say anything that they want about anything without the slightest bit of justification, or more specifically, without any science behind it. And people will look at it and probably believe it. So Dr. Deaton made a comment Jackie, when we implemented HPV discussions in our office, we were concerned about negative parental reaction. We only had positive reactions. So that's great to hear. That's good to know.
Dr. Deaton, you're ahead of your time. That's awesome. Thank you for adding that comment.
And I see the email for the post-session survey has gotten out. So look for that. But again, it's in the chat as well. Time constraints are huge in our office. Just having accessible info is critical. And she also said, that's Tony Marquardt. She also says, I do remember that controversy.
But that comes in where you have laminated brochures, laminated trifold brochures. They're up on the wall, they're on the waiting room tables. These are all things that if, again, time constraints are huge. There's no doubt about that. But a lot of information can be gotten out there via social channels, via laminated copies of things. When they're sitting there waiting, it's a perfect time for them to be able to absorb that information and correct information.
I wonder if there is that type of material available from the Missouri Department of Health and Senior Services. So I'm asking a question that someone would have to answer in chat.
I know you can find with the shared Google Drive, you can see I'd say there's at least a dozen brochures. And I know the Missouri Department has put out their own brochures about HPV and cancer relationships, but then there's brochures from just so many different organizations that can be downloaded and just, basically printed out and laminated. But I know information is on the website as well. Julie and Dr. Deaton, if you want to chime in on that, feel free. Okay.
And I'll also say that if Julie or Dr. Deaton would like to speak, Ashley is prepared to, for a nominal fee, give you the opportunity to actually be seen and heard. I see no such request so far. It's probably that fee issue. Dr. Deaton says, sure. So Ashley, can you, there we go. And Julie.
Can you hear me? Are we rolling?
Can.
Well, first off, Jackie, great presentation. Really good. And I have to say that I was on a division call about an hour preceding this, and closing had mentioned to the director and DCPH and the director of DHSS that MCOH and the Office of Dental Health was helping to coordinate this HPV vaccination training for dentists, and they were just thrilled. And this is the type of thing that the Department of Health and Senior Services wants to encourage. They see dentists as an integral part of the public health team, and this integration, particularly if it can be coordinated with providers who are enabled to give vaccines the same day, is shown to have a positive impact. And Jackie, you did a great job of explaining that. With luck and a little grace of God, maybe those vaccinators can be dentists by the fall. And if that's the case, then we're really set to go. But the thing I want to say, just to echo what Jackie said, is that, we do a great job in helping people with oral health. We can be a very important care provider in guarding the overall health of our patients, and HPV is a great example of that. So I enjoyed it immensely, Jackie, and thank you so much.
Absolutely, my pleasure. Thank you. I'm looking at the chat, and Dr. C made an excellent comment. Another teachable moment: while performing an oral cancer screening on a parent, bring up the topic of the vaccine for their children. Excellent. I mean, that doesn't take any extra time. It brings up the conversation. And as you're examining for oral cancer, you're explaining how your children can prevent cancer with the vaccine. So thank you for adding that. That's amazing. Looks like you put up the CE code, Gary. So how would everybody put that in as part of the survey, or tell us how that works, please?
I muted myself. You will find a place on the survey to put that code in, and that is why actually the CE process is why we do not put the recording up here immediately. We'll do some reminder surveys for this, and for those of you who attended, you'll have the code and you can complete the survey. After a couple of weeks, we'll put the recording out, and people can't get CEs off of watching a recording. You have to participate live, as you have all done today.
But
Gary,
go ahead.
hey, Gary and Dr. Miller. Thank you, Dr. Miller, for a great presentation. Thank you, Gary, for hosting it. So the Bureau of Immunizations does have literature on HPV vaccinations. I will just have to find the link where people can order those from our warehouse. I think we have it available too, but I can send the link to Gary, and if they can send it out, because I don't know if I can find it before the end of this webinar. So I just wanted to let everybody know that there is HPV literature and targeted to oral pharyngeal cancer as well. So I'll get that link as soon as I can find it.
Thank you so much, Julie.
I appreciate that. I was looking around on the website to see if I could locate it while we were talking. There's some great stuff out there on HPV, and I put the link in, as mentioned, to the immunization page for Health and Senior Services. There's a lot of good information out there. Didn't see a place to order literature, but I'm sure we'll get that out to you.
Okay, it doesn't look like there's any more questions. Please fill out the survey, and if there's any way that I can improve this presentation, I'd appreciate it. I appreciate your heartfelt comments, and I can't thank everybody enough for being here today. I'll let Gary end it out.
Well, Dr. Miller, I want to thank you very much for really an excellent presentation, excellent information, and I'm so glad we had so many attendees today. And for those who aren't on here, we don't know what happened, that some people didn't get our emails. We sent out several ahead of time, but we did have some issues with links, and hopefully everybody who wanted to attend was able to attend. I again want to thank St. Jude's Immunizations and Department of Health and Senior Services and the MPCA for providing CEs. That is their process. It will take a while for you all wanting to get CEs. They will actually issue that material, and they have to process that. So it does take a little bit of time, but thanks very much to everyone for supporting this. Any final words from anyone? All right. Well, I think we are all better educated and aware, and more importantly, aware of some particular things that can be done to improve immunization rates for HPV and save lives. So thank you very much. I hope you all have a great weekend.